In this video, I want to talk about a type of damage that can affect the skin and that can deeply impair skin functioning: a burn. You're probably used to thinking of burns as being something that happens when you put your skin in fire, but a burn technically is any tissue damage occurring due to cell death and denaturing of proteins in the tissue. So you can have burns due to heat, certainly, but also due to electricity, radiation. You can have chemical burns. Burns is just a more generic term indicating you've had a region with lots of acute cell death. Burns can be classified according to the depth of the burn. In a first-degree burn, it's really just the epidermis only that's damaged. So in a first-degree burn, you see swelling, you see redness, you certainly see pain. In a second-degree burn, you have epidermis and dermis damaged. So it's a deeper burn, and this is the kind of burn where you actually develop blisters. A blister happens when you have separation of the dermis and the epidermis, or separation between epidermal layers, and that space where the layers got separated fills with fluid. A third-degree burn is sometimes called a full-thickness burn because it involves the epidermis, the dermis, even through the hypodermis. Patients with third-degree burns may actually have exposed muscle tissue, and you can even have burns so deep and severe that it burns through the underlying muscle and you have exposed bone. Third-degree burns may actually be less immediately painful at the site of the third-degree burn because all of the nerve endings that would normally detect pain in the dermis are gone. They've been burned away. There may still be large amounts of pain through damaged tissue around the burn, but at the site of the burn itself, those pain-detecting nerve endings are gone. These images show you the different depths of burn. Actually, you've got the first-degree burn here. You can just see the redness. You can see the blisters that characterize a second-degree burn here, and the third-degree burn here. The presence of the black or white tissue, that's just charred, completely dead tissue. That's a hallmark of a third-degree burn. To understand the dangers of burns, think back to the functions of the skin. One of the major functions of the skin is to prevent fluid loss, and fluid loss is the first most immediate danger of severe burns. Burns damage blood vessels, so you get plasma, the fluid from the blood, leaking out and evaporating. There's nothing to hold that fluid in the body. And the more fluid that is lost, the less fluid there is circulating through the blood. So the heart's ability to pump blood through the body becomes impaired because there's just not enough blood volume to fill the vessels. So in severe burn patients, replacing lost body fluids is absolutely critical. Now, if the severe burn patient survives that initial fluid loss, the second most dangerous complication is infection. And your skin is the barrier between your tissues and the outside world, and the outside world is a soup of bacteria and viruses and fungi and all sorts of dangerous infectious organisms. And sepsis, which is infection of the blood, is actually the leading cause of death in burn victims. And there's a couple of different reasons. First, there's the breakdown of the skin barrier, but also, and this isn't super well understood, but in a week or two after a severe burn, the immune system actually kind of wipes out. The immune system, it's thought to be a form of exhaustion. Like, the immune system has just been working so hard to protect the body when the skin barrier has disappeared, that it just cannot keep up, and it wears out, and it you will see actually a drop in immune response a week or two after a severe burn. So just as the patient is in most need of a strong immune response, the immune response actually flatlines. So managing infection, keeping the wound clean is absolutely critical as well. As far as repair, first and second degree burns typically can heal themselves without too much clinical intervention, as long as those burns are kept clean and kept undamaged. The tissue, even the tissue underneath the blister, will repair itself. Third degree burns need clinical assistance in order to heal. That burned dead skin, remember the kind of blue or black charred pieces of skin? That's called the eschar, and it has to be removed. And the process of removing that dead skin is called debridement. So that burned dead skin has to be removed, and this is often done surgically, although there's kind of a way that for more severe burns, some hospitals actually use maggots to debride a wound. Maggots are special in that they absolutely only eat dead flesh. So if you put, I'm not talking about like maggots from, rotting meat you may have left out on your counter. I'm talking about aseptic clinical maggots for clinical use. If they're placed in a wound, they will eat the dead tissue and leave the healthy tissue unaffected. So they'll get rid of that dead tissue that can actually get in the way of regeneration. And they are much better at removing only the dead tissue than a surgeon. Even a surgeon cannot always tell by eye exactly where the dead tissue ends and the living tissue begins. Maggots, the living tissue just doesn't taste appetizing to them. So debridement, whether you're doing it surgically or whether you're using maggots, the dead skin has to be removed. The second part of repairing a third degree burn is using a skin graft. Remember from our discussion of skin repair that if you have a really big wound in the skin, the cells on either side are going to have a hard time replacing the tissue. It's just too big. But if you take a skin graft, what you do is you take a kind of a lattice work of skin from a healthy area of the body and you transplant it over the burned area so that instead of having one big wound, you now have a series of smaller wounds, and you can have living cells populating and filling in the wound from the graft tissue as well as from the edges of the tissue that was originally there. So skin graft turns basically one giant wound into a series of smaller wounds that can be more easily prepared through the regenerative processes. Alright, after studying this video, you should be able to do these. You should be able to distinguish between first, second, and third degree burns, talk about the most important concerns or the most dangerous consequences of severe burns, and talk about how debridement and skin grafts are used in treating severe burns.